Welcome to the Belly Brain Connection. I'm Hannah Winans. I'm a certified functional nutrition counselor, and I'm on a mission to help educate people about the connection between their gut health and mental well-being. I believe that our gut health is the cornerstone to our overall health, and when we nourish our bodies, we nourish our minds. Belly Brain is for informational purposes only. I'm not offering medical advice here. If you need medical advice, please consult your physician. Welcome back. It's episode 19. Last week, we covered a little bit about the oral microbiome and gut health connection. And I posted a video on the Belly Brain website. It was a YouTube interview that was done with Dr. Andrew Huberman and Dr. Stacy Whitman, who is a functional dentist, pediatric dentist, and really, really fascinating interview. I mean, it's about 3 hours long. So I kind of just went over the high points with you guys. And our food of the week last week was the incredible edible egg. I'm a big fan of eggs. And so we talked about the health benefits of those. On the oral microbiome note, Dr. Stacy Whitman, she has a toothpaste that her company makes. It's called FIG, FYGG, and it's an acronym for Feed Your Good Guys. And it's a toothpaste that does not have fluoride in it, but has probiotics and prebiotics in it. So I've been giving it a try. I told you I'd report back. I'm starting to like it. It, like I think I mentioned in the last interview, it doesn't have a minty, fresh feel necessarily. It's kind of sweet. It doesn't get real foamy. But apparently, from the interview that I listened to, a lot of those ingredients in toothpaste that give that really pungent kind of clean, foamy feel are not things that we actually want to be putting in our mouths. So reporting back, I like Fig. I recommend it. Again, I'm not sponsored or I'm not selling anything here. I just thought I would report back to you guys. So I'm getting to learn to like it more, and we'll see. We'll see if it helps with my oral health. Let's see. For today, though, I wanted to cover your skin microbiome and your gut microbiome and the connection between the two. Basically, that's being called the gut skin axis. What I've found in all my gut microbiome, gut health research, there's the connection between skin issues like rosacea, eczema, psoriasis, so many skin issues, they seem to be linking to gut health issues now and seem to be connected to things like leaky gut and SIBO. So I wanted to explore that a little bit. And the deeper I dive into it, the more I realize there's so much information. I'm struggling with how to get it to you. So I think, again, like with all things belly brain, I'm just trying to create awareness so that if maybe one of these things sounds familiar to you or is something that you're experienced, that you'll take it upon yourself to research it and reach out to your physician and your doctor. But I'm just kind of trying to be the voice for it, trying to just maybe get people to stop and think about some of the problems that they're experiencing with their health and their skin and their mood, that, maybe that's connected to their gut. So I'm just going to give you a little bit of information, and then I'm going to link some things I'll link these articles and studies to the website at bellybrain.com. And then for our food of the week, this week is carrots. I'm on a carrot kick. I know I keep saying I get on these kicks, but I really do. I was on a pineapple kick, I think last week or a couple weeks ago. But carrots, I realized I've got kind of a theme going with the eggs last week and the carrots this week, and it's spring and Easter's next week. So I think carrots are a good food to talk about during the spring, and we'll talk about some of the health benefits of those. I also mentioned a yogurt that I found that I really love, Strauss yogurt, Straus, and it's an organic yogurt that I feel like it is the best I've had out of everything that I've been trying. And I was really excited because I started doing a little more digging and kind of checking into the company. And I really love what they're doing. So I kind of made some notes here, but the Strauss is a family dairy and they're in Petaluma, California. And I'm up here in Humboldt, so we're not too far away. But not only is their family owned company, their yogurt's organic, but they also are practicing carbon neutral organic farming and regenerative farming. So I thought that was kind of neat. Every time I recommend a product to you, I am going to try and do a little bit of the backstory on it so I can present to you a little bit more about the company. So for the gut skin access explained, I'm going to read to you a study that I found. It's on the Global Autoimmune Institute is where it's from. And I'm going to read this to you directly, like I've done in the past, because again, I'm just trying to get you the information and then you can take it further if you want to. But what they have to say at it, this was an article, well, this was written by Jennifer Sang, PhD, in January of 2025. So this is a really recent article. The gut and the skin are the two biggest surfaces of the human body. Each of them measures about 25 to 30 square meters and is home to billions of microbes known as the microbiome. They're both places that shield us from the external environment. Because of their roles in immunity, they're also sites where autoimmunity tends to occur. While seemingly separate entities, the gut and the skin influence each other in many ways. The communication between the gut microbiome and the skin is known as the gut skin axis. It's an emerging field, but we know that the microbes in our gut can influence immune function in the skin as well as other cell types, says Martin Kriegel, chair of rheumatology and clinical immunology. Sorry about that, at the University of Munster. That skin damage leads to changes in the gut microbiome. Stress from the outside leads to stress on the inside. Stress from the inside leads to stress from the outside, notes Chris Callowart, a microbiologist and bioengineer at Ghent University, as he describes the gut skin axis. And I'll stop here because I wanted to kind of share with you a little story that we had in our household where I had a family member who was going through this really strange situation with dry, cracked hands. And it was really bad. And we couldn't figure it out. And they tried every cream you can imagine, every lotion, went to a dermatologist, tried everything, and nothing was helping. And it was just getting worse and worse. And to say it was bad, I mean, this person was in a lot of pain. And basically, through changing diet, and we didn't really make that connection back then. We just were starting to make changes in basically the amount of carbs we were eating in our house. And so we were bringing in a lot less bread, a lot less gluten. And over time, that skin issue has gone away. And there hasn't been any magic lotion or anything else that we've brought in to change that. And so I really think it was the change in our diets that there may have been, looking now that I know what I know, that I have a feeling that maybe the gluten was causing the issue. And gluten can cause, well, they say it can cause leaky gut syndrome. And so I think somehow maybe the flour, the gluten, the crackers, those types of things were creating some gut dysbiosis. And I think that's maybe why this skin flare up was happening. So, and we know too that certain probiotics and certain bacteria can really help your skin. So that L-reuteri yogurt, which I talk about a lot, that specific bacteria in that yogurt is known to help the skin. So clearly there's a skin gut access or skin gut connection, but I think it's being really overlooked. I think that people who have rosacea, there were some studies here, and again, I'll put this all in the Belly Brain website, but there were some studies here connecting rosacea with SIBO, small intestinal bacteria overgrowth. So they're finding that a lot of people that have these skin issues also have gut health issues. Let's see some of the other issues that can come up with skin, and they're finding connection with the gut microbiome is alopecia, atopic dermatitis, psoriasis, vitiligo. So there's a study that compared sites affected by the vitiligo versus unaffected skin, found that the microbial diversity was reduced in sites affected by the vitiligo. Different types of bacteria also dominated in sites affected by vitiligo. So they're finding that they're finding certain strains of bacteria in the gut of people who have some of these skin issues. It's different than the people who don't. And so again, that there's more research that they're doing, but and you have to keep in mind that this whole gut microbiome thing, this is all kind of newer science. So I feel like by unlocking the gut microbiome and the mysteries of it, they're finding all these other connections that I think are going to help people in the long term. Here it says, can healing the gut microbiome reduce autoimmune skin disease flares? And they say that it can, and there's a strong link between diet, gut microbiome, and autoinflammatory diseases. But again, it may not be the cure all for everything, but I do think it's something to really look at. If you have skin issues that are not going away, no matter what you're trying, no matter what your dermatologist is telling you, Have you looked at your gut? Have you looked at your diet? Allergies, all of those things. We have to go back to the gut and always remembering that 70% of our immune system resides in our gut. So if there's disruption there, it's going to show up in other places in our body. So, like I said, I was really struggling trying to figure out how to get this information to you because there is so much stuff. But I just wanted to kind of hit the high points and just kind of make you aware of that connection and give you some resources to do some more investigating on your own. There's also they're doing they've done a couple studies that are connecting the gut microbiome and melasma, which is a skin issue that I've been dealing with for a long, long time. And I've got it under control. It's not a big deal anymore, but I've had, a lot of really expensive products and creams and things like that. And to think now that maybe I should have started in the gut first is pretty interesting. And honestly, as my gut health has gotten better, so has that issue. And so I ran across that study, and there's more work for them to do on it, and it kind of blew my mind. So if you're into this kind of thing, the more you dive into it, I think you're going to find it really fascinating. Um, yeah, see for yourself, check it out, do the research, do the homework. But the thought of people who have maybe some really painful skin issues that are really suffering, um, maybe you don't have to suffer. Maybe there is something else that you can do that you haven't tried already. Let's see. Okay, so with that note, I'm going to switch over to our food of the week. Speaking of skin, these carrots, they can turn you orange, apparently, but you have to eat a lot of them to do that. So why do we like carrots? Carrots are full of fiber. Fiber is really good for your gut health. I'm constantly, looking at where can I get my fiber in for the day, and I don't always want it to be a salad. I don't always have time for a salad. So one of my favorite things to do is just grab a big old organic carrot, throw it in the car with me and chomp it as I'm driving down the road. I mean, I know there's baby carrots out there. I've heard some things that I haven't really researched because I'm not into baby carrots so much, but I've heard that some of the baby carrots that aren't organic, somehow maybe they get soaked in some kind of a hydrogen peroxide or bleach, or there's something that they do to them to keep them from deteriorating. I'm not exactly sure. That's maybe something I can research later. But I prefer just a big old, Bugs Bunny, what's up, doc kind of carrot that I just have handy with me. I don't even always peel, scrape them. I just wash them really good. And I feel like they're great for an afternoon snack when you just need something that has a little bit of sweet to it and crunch. Yeah, I think they're great. I don't underestimate how refreshing a carrot can be in that late afternoon because you get a little bit of the carb and it gives you a crunchy feel, and you've got some fiber to kind of help fill you up. So it might be a good thing like right before dinner or like 3 o'clock when you need something, grab a carrot. It's a great snack. The vitamins that carrots have, my mom used to always tell me that carrots were really good for our eyes. And she's right, because it is lutein. I think that's how you say it. Lutein. It's one of the most common antioxidants in carrots, and it is predominantly found in yellow and orange carrots and is important for eye health. So the vitamins that are in carrots, vitamin A, biotin, which is interesting. Biotin plays an important role in fat and protein metabolism. Vitamin K1, potassium, vitamin B6. Some of the other plant compounds that are in carrots, beta carotene. So orange carrots are very high in beta carotene, and the absorption is better when the carrots are cooked. Alpha carotene, lycopene. Lycopene is the bright red antioxidant found in many red fruits and vegetables. And let's see, including red and purple carrots, lycopene may decrease your risk of cancer and heart disease. I'm looking for other notes. So if you're watching me, look around. That's what I'm doing. Cooking carrots helps release lycopene and improves absorption. So one of my favorite things to do with carrots is when I cook a meatloaf or I cook a roast, I usually, because I like I've said in the past, we kind of lean low carb, but I chop up some carrots, kind of keep them nice and thick, and mushrooms, and I throw them around the meatloaf or the roast or whatever it is that I'm cooking when I'm roasting it all. Those carrots kind of turn out perfect. So even if sometimes they come out a little bit burnt, and I like it. So we love it. Throw in the carrots, throw in some mushrooms. It doesn't always have to be meat and potatoes. There's other options out there, although I do like a potato. But yeah, just a roasted carrot that's been kind of cooked around some kind of meat is really delicious. Let's see, lots of other, there's anthocyanins, another antioxidant in them. Consuming carrots has been linked to lower cholesterol levels. It says here, females, and this is, where did I get this study from? I think this is from Healthline. Females with high circulating levels of carotenoids may also have a reduced risk of breast cancer. And then again, the eye health. So just a lot of great health benefits. I mean, our simplest foods, right? The foods that we find in nature sometimes have the biggest nutritional punch. So why can carrots turn you orange? And honestly, you have to eat a lot of carrots for them to do this to you. But years ago, I had heard about some kind of pill that you could take that was like a internal self tanner. So you would take this pill and you would get dark like overnight, and I think it was full, I think it was full of carotene, which was what turns you orange. If I remember correctly, I'd done like a little research on it because I was interested. I was like, hey, if that's gonna, give me a tan overnight, that's great. And then I realized you're basically like over consuming beta car beta carotene. I thought that's probably not a good idea. But when their skin has turned temporarily orange from carrots, which this will be kind of fun for kids to know, it's called carrot anemia. And it's pretty uncommon. It doesn't just happen with carrots. It can happen with other beta carotene foods like apricots, cantaloupe, mangoes, oranges, sweet potatoes, yams. But you'd have to eat a lot. One article says if you're eating up to 10 carrots a day for a few weeks, you could develop it, but I don't think anybody's eating 10 carrots. So I think you're safe. I think just have a few carrots, enjoy them, chop them up, put them on a salad, put them around a roast, like I said, or just even if you don't do meat, just throw them in a roasting pan with some other veggies. I need like some thick chunks of red onion would probably really be really, really good. But yeah, I'd say that's kind of a go-to snack for me. And then I found these fermented carrots that I love. I've been wanting to ferment stuff myself, but I'm just not finding the time. So I buy these fermented carrots at Wild Berries in Arcata, and it's Wild West ferments. And I've mentioned them before, but I really like their fermented foods. I get their beets, and they've got some other things there. But the carrots are really good because they're not too strong. And again, you can throw them on salads. I don't eat a ton of them. I just, sprinkle them on top. A lot of times I'm having my salad and I want a crunch in there, but I don't want to chop anything up. I don't feel like it. So I can throw those fermented carrots on it, gives it some texture. But that company, they're from California as well, and they're from Point Reyes, and they do small batch fermented foods. So again, I mean, it's not as local as Humboldt, but I still love the idea that these are small companies who are really trying their best to not only bring wonderful products, healthy products to us, but that they're doing it in a conscientious way. So Wild West ferments, Strauss yogurt, eat your carrots, check into your skin. If you're having issues, ask your doctor, do some research. It could very well be linked to your gut health. I appreciate you all for tuning in. Next week is episode 20, and I think we're going to do something a little bit different. But just enjoy your week, and I will see you then. And I hope this helps.